Are you a patient desperate to find a specialist physician? Did you get a referral from your primary care physician and you cannot find a specialist in your network for the next 4 to 6 months? Did you feel rushed in your last 7 to 12 minutes appointment? Are you frustrated by the lack of transparency regarding the costs of your care? And despite paying more and more for your health care insurance, each year you receive less and less in your medical care. You are not alone. There are millions of patients that feel the same. Hello everyone, I'm Dr. Diana Garnita, a board-certified rheumatologist practicing direct specialty care. In 2020, I transitioned into private practice and founded one of the first direct specialty care practices in rheumatology in the United States. My company opened the door to many patients like you that were desperate to find a specialist when they needed the most. People like you that felt disappointed by short visit appointments and moved from specialist to specialist in an effort to find out what is going on with their health come to see me in my practice. I hear this story every day. I am here to tell you that there is an alternative way to receive the proper medical care, actually excellent medical care. Let's talk about the traditional medical system that we know today. When people think of healthcare, they think of today's traditional healthcare system. This comes to no surprise to none of us. It is what most people have most experience with, and this is one of the things that may have grown up with. However, not everything that we use today is perfect, including our today's healthcare system. Decrease access to care. Medical care and healthcare insurance are not equal. Sadly, carrying a health insurance card does not guarantee the medical care that you need. Most patients that come into my practice carry health insurance, but when they need to use it, they do not have access, or that access, it comes months too late. In many specialties, including rheumatology, waiting times are for about 4 to 6 months. This is detrimental, as waiting for months on end will only worsen your condition and lead to sitting in more pain. Decreased time with physicians. A significant problem with today's healthcare system is that waiting times for appointments is paired with relatively short visits. When you finally are seen, you have approximately 7 to 12 minutes with the physician. Is that enough time for you as the patient to address your concerns? No. Is that enough time for any physicians to examine, diagnose, and offer you a treatment solution for your problem? No. Physicians need time to understand and get to know their patients. Physicians need time to construct a plan and provide excellent medical care. Time with patients is of essence. This is equally frustrating for patients and physicians and often decreases the quality of medical care that you will receive. So why is this happening? The answer is quite simple: profits. Physicians are not valued based on how well they provide you care in the big medical systems. Our value comes from billing, CPT codes, and productivity models. The more patients we see, the better revenue for the system. This is why physicians are often swamped with patients, having to see as many as 30 in one day, yet only spending 10 minutes with each patient. Astronomical costs. The cost of health insurance increases every year, but what you receive in medical care decreases every year. We all know that the costs of healthcare in the United States are astronomical. Healthcare insurance is supposed to protect patients from medical debt. It is supposed to be your safety net, but it does not do its job. I know many patients that carry insurance, but they are afraid to use it. Despite paying for copayments for your medical appointments, it is common to receive surprise bills many months after you received care. The costs of your care are not disclosed, and you, the patient, cannot make an informed decision. Why are the costs in healthcare so high? It is simple. There are too many layers, too many middlemen between the patients and physicians, which will result in higher and higher costs. Many patients in the United States with health insurance file for bankruptcy because of medical debt. Ultimately, this dramatically affects the price of your health. Most times, patients pay far more than what they think is a monthly insurance rate. What is direct specialty care? Direct care is the practice of old-fashioned medicine, where the doctor and the patient have a direct relationship. In this way, patients contract directly with their doctor. Patients have the advantage of not needing a referral to see the specialist that they need. It is simple. Patients call and make an appointment with the specialist that they need when they need it the most, without spending endless time waiting and without any interference between the patients and the physician. Patients are examined, a diagnostic test is ordered or performed, and then they receive treatment. The payment for the service is made directly to the physician's office. It is that easy. Patients, regardless of whether you are healthy or you are in urgent need to see a specialist, know that you do have options. You are empowered to spend your money on services that you need when you need them the most. Your life and health are valuable, and your disease does not wait to get a pre-authorization for your test or for your treatment when you need it now. Contracting with a direct care specialist like me and others will come with incredible benefits. You will get to the specialist that you want when you need. You will receive adequate amount of time during your visits. Most of us, we spend an hour with our patients. You can ask questions and you will receive answers. You will have direct communication with your physician. You will have an email, a text, message, or you will have the phone of the physician. You will receive personalized care. And on top of that, the care is affordable and the prices are transparent. You do not have to pay copayments and you will never receive a surprise bill. Your direct care specialists work hard to offer you significantly discounted prices for your laboratories, your imaging tests, and even for many, many treatments. Direct specialty care restores the relationship between you, the patient, and the specialist physician. Direct specialty care offers you time, value, expertise, access to your doctor, personalized care, and excellent medical care at affordable and transparent pricing. You, the patient, have the power to decide what is best for you and where your money goes. The future of healthcare is in your hands.